I'm Dr. Jacob Egbert with Primal Mountain Medical Testosterone Replacement Clinic, and I'm going to talk about the top 10 myths associated with testosterone replacement therapy. Let's dispel some myths. So, first of all, let me just talk about TRT. What is testosterone replacement therapy? Well, if you have lower levels of testosterone than is optimal, you're low T. You likely will have a number of symptoms: lower libido, less erection quality, decreased energy, poor mood, less enjoyment of life, less muscle mass, less energy overall, less confidence. The list goes on. Low T is a real situation for many, many men in today's society. Now, there's a reason for that. One of the biggest reasons is environmental factors. We have exposure to things that are hormone disruptors, plastics and pesticides and chemicals in our food and our soaps, et cetera, et cetera. Things that you just don't know how to prevent because they're insidious. They're just there within the things that you expose yourself to. Next, nutrition. Nutrition is poor. It just isn't what it used to be. Our fields are depleted. Our animals are raised in cages. And the quality of nutrition has declined over the years. Yes, we have an abundance of food, but sometimes that food isn't the best quality. Next, we have more stress. This technological world, this high-paced environment, all of the things that we're dealing with has resulted in lower testosterone levels. We don't exercise as much. We're not as physical. Humans used to be very physical in the world. We sit at desks, we drive cars, we're very comfortable. That has resulted in lower testosterone levels. And largely, we're fatter. If you have any sort of body fat on your body, that reduces your testosterone because body fat converts testosterone into estrogen. It just does. So all these factors combined has resulted in a lot of people with lower testosterone levels than is optimal. If you compare the population of today to the population of 50, 60, 70 years ago, 100 years ago, our testosterone levels are almost half what they used to be in your age category. So this is almost an epidemic, unfortunately. You want to have high testosterone levels because you want to function and have all the benefits of testosterone: muscle mass, bone density, confidence, energy, metabolic health, all the things that make you a man. And a lot of things are out of your control, unfortunately, that have led to or resulted in lower testosterone levels. So testosterone replacement therapy has become this wonderful product that's available in clinics all over the country. So why aren't you doing that? Well, there's probably some considerations or some objections and some things that you've heard. You're like, I don't know, that sounds dangerous, or there's problems associated with taking testosterone. So I want to talk about the top 10 myths that I deal with or hear about almost daily. And this is what they are. Myth number 1: testosterone results in aggression. You're going to become roid ragey. Well, it's just not true. If you look at studies that show the aggression levels of men on testosterone as opposed to men not on testosterone, there's actually less aggression in the testosterone group because it enhances mood. It enhances enjoyment of life. It gives more confidence, and all of those things result in less aggression. Now, one factor is this: when you're on testosterone, you become more assertive and confident. And you stand up for yourself. You don't take any shit from people. And that may be considered aggression by others. But it doesn't make you more aggressive or violent or roid ragey. It just doesn't. Myth number 2: testosterone replacement leads to prostate cancer. Not true. Statistically, if you look at the population on or off, the incidence of prostate cancer is the same. The only consideration, and this is where that myth likely comes from, is that certain prostate cancers, if you do get them, do grow faster or are more aggressive if testosterone is present. Now, the reason this becomes a myth is because when you're diagnosed with this particular prostate cancer, they will give you medications that suppress testosterone. But they'll do this whether you're taking testosterone replacement or not, because any testosterone at all is dangerous for this particular cancer. But testosterone replacement does not increase your risk of cancer at all. That's just a myth. Myth number 3, taking testosterone will make you become sterile. Not true. So let me explain why that is. If you're not sterile, you're producing sperm that can lead to reproduction, and you start taking testosterone, your sperm will still result in reproduction. It's just the way it works. If you're sterile before, you're still sterile. If you're not sterile, you won't become sterile. The myth comes in this. If you're on testosterone replacement, you do have suppressed sperm count because the testosterone is added external and not required within the testicle. So you have lower sperm count while on testosterone. There are medications you can take that will ramp that up. So if you want to have a baby and you're taking testosterone, you take these extra medications, or you stop taking testosterone and sperm comes right back. You do not become sterile. Myth number 4, testosterone replacement is only for old men. Unfortunately, for all the reasons that I mentioned previously, people are experiencing low T at younger and younger ages. We've got patients that are in their 20s, their early 30s is actually quite common to start experiencing low T. We do the labs, their testosterone levels are in the floor. Well, they've done all the other things and it's still down. We start replacement therapy in your 20s, in your 30s. That's just common. It's not just for old men. So testosterone replacement therapy can be beneficial at any age if you have the low T symptoms and lab values that are below optimal. So myth number 5, testosterone replacement therapy or exogenous testosterone is only for bodybuilders. Sure, bodybuilders absolutely need testosterone in order to build those giant bodies. You can't build muscle without testosterone, but you don't have to be a bodybuilder to be on testosterone. That's just a myth. So taking the injections of testosterone is not a steroid like you think of when you talk about bodybuilders. Yes, testosterone will enhance muscle mass, but you're going to need some extra stuff if you want that bodybuilder physique. Myth number 6, testosterone results in testicular shrinkage or small balls. Well, not true. The vast majority of men do not have any shrinkage of their testicles at all on testosterone. About 20% will have a reduction in size. That's true, but it's not significant for the most part, and it's not like they shrivel up into little raisins. It just isn't true. So, vast majority, none at all. A small minority, a little bit, but nothing else shrinks, so that's the good news. Now, myth number 7, testosterone replacement therapy results in baldness or hair loss. Again, it's a myth. Testosterone has a byproduct called DHT or dihydrotestosterone. And some men have a genetic predisposition or hypersensitivity to DHT. And that's where male pattern baldness results. So if you're a man predisposed to hair loss, whether you're on testosterone replacement therapy or not, you're going to be exposed to DHT and you're going to have hair loss. So taking testosterone, you're going to have maybe a little bit more DHT than you would if you didn't, but not enough to preserve your hair. So if you're going to go bald, you're going to go bald whether you're on testosterone or not. That's the reality. And the myth is that being on testosterone causes baldness. It doesn't. Okay. Myth number 8, testosterone replacement results in immediate, instant energy and muscles just pop. It doesn't work that way. It's not an immediate fix. It's not like you have this burst of energy with that first shot. It takes time. Typically, I say 3 to 6 months to get dialed in and to get settled into your optimal levels. And if you're consistent with your workouts and your diet, you're going to make some significant changes in your body mass, your body composition. You're going to feel better. Energy is going to be up, but it's going to take some time. This isn't like caffeine or some other drugs where immediately you have a result. Myth number 9. Now, this one I hear a lot. Testosterone replacement turns your blood thick and can put you at high risk of blood clots. This is a concern. Like, you don't want to have blood clots. That can be dangerous. But the myth is that testosterone results in blood clots. It doesn't. There are no studies or no evidence for that taking testosterone results in blood clots. Now, where this myth comes from is that taking testosterone does increase your hemoglobin and hematocrit, or your red blood cells. They increase. You get more of them. This is why cyclists and other endurance athletes will take testosterone, because it increases red blood cells, which carries oxygen for endurance sports, cardiovascular fitness. The thing that people get confused is that when they see those elevated numbers, they think, oh no, thick blood, risk of clots. What they're confusing is a disease called polycythemia vera. Polycythemia vera increases all of the blood cells. That includes platelets. Platelets are the things that cause clots. So somebody with polycythemia vera will have high H&H, or hemoglobin and hematocrit. Somebody on testosterone will have high H&H, hemoglobin and hematocrit. People with polycythemia vera will have high platelets. People on testosterone will not. The testosterone does not cause increased platelet counts. It stays normal. And therefore, the risk of clots is the same as anybody. That's just the way it is. So, no risk of clots with testosterone replacement therapy. Now, myth number 10, taking testosterone increases your chance of strokes and heart attacks. Again, no. It actually lowers or enhances your cardiovascular health through a number of reasons. One, it increases vascularity, or blood flow, throughout the whole body. You have increased muscle mass, therefore you have better metabolic health. If you have more muscles, you burn through energy more, you burn through sugar, you burn through fat. You're just more robust and healthy at baseline than somebody who has lower muscle mass, or all those other factors. So therefore, largely from the population, if you had 100 people on testosterone and 100 people without, you're not going to have an increase in strokes with the testosterone. It just isn't the case. There's no studies that show this, and it's actually an enhancement of overall health and vitality. So those are the top 10 myths associated with testosterone replacement therapy. If you have questions, reach out to me, primalmountainmedical.com. Reach out to me on my social media, Instagram, Facebook, YouTube, and I'll answer any of these questions that you may have. If you want to get in for a consultation and you live in Utah, come see me.